Have you ever watched a nurse do something that looks, well, simple and wondered what's really going on there? Today, we're going to step inside a nursing clinical training session, and we're going to uncover the incredible science and skill that goes into what might just look like everyday care. So that's the voice of a clinical instructor walking a student through just one of dozens of critical procedures. And that one word she uses, priming, it hints at this whole hidden world of technical steps and safety checks that are totally second nature to a nurse, but are literally life or death for a patient. So where are we? We're in a skilled nursing facility. This is where students get paired up with experienced nurses, their preceptors. And let me tell you, this is not some relaxed classroom. It is a high-stakes, hands-on environment where the learning curve is incredibly steep and the responsibility is immediate. Right from day one, the pressure is on. The goal for these students is to prove they can safely and competently handle a huge range of tasks. Every single thing they do is watched, corrected, and perfected, because pretty soon they're going to be doing all of this on their own. Okay, so let's focus on one of the most important things a nurse does, giving medication. And it all starts right here with the medication cart, or as they call it, the med car. And believe me, this thing is so much more than just a simple trolley. I mean, just look inside. The sheer variety of tools is what's really amazing. A nurse has to be an expert on all of this. You've got simple things like a pill cutter, and then electronic devices like a glucometer for checking blood sugar. You have specialized items like insulin pens, and even things like thickened water for patients who have trouble swallowing. Oh, and of course, a locked narcotic drawer for controlled substances. Every single one of these requires its own precise procedure. And this gets at a fundamental safety rule. You see, while some general items like applesauce or maybe some over-the-counter meds might be shared on the cart, anything that's prescribed is strictly one per patient. As the instructor says, you don't want to grab Jeffy's pen and give it to me. An insulin pen, eye drops, those are assigned to one single person to prevent a potentially catastrophic mix-up. So to really understand the level of detail we're talking about, let's just zoom in on one of those items, the insulin pen. Preparing and giving insulin is a multi-step process that demands absolute total precision. So how does a nurse even know how much insulin to give a patient? You might think it's just a fixed amount, right? But it's often way more dynamic than that. The dose can literally change every single time based on what the patient needs in that exact moment. It's managed using something called a sliding scale. It's an order from a doctor that basically creates a custom responsive dosage plan. It's not a one-size-fits-all instruction, it's completely tailored to the patient's real-time body chemistry. And here's what that looks like in the real world. First, the nurse uses that glucometer to get a blood sugar reading. So let's say the number is 225. They look at this chart, they find the range, 201 to 250, and they see that it requires 4 units of insulin. So 4 is the magic number they have to prepare. But get this, once they have that dose, 4 units, the process is not over, not even close. In fact, it's just beginning. The nurse now has to follow a strict 4-step protocol to get the pen ready before it ever even gets near the patient. First step, check. The nurse confirms the name on the insulin pen actually matches the patient they're with. Then they check the expiration date on the pen itself. You know, expired medicine can be less effective or even harmful. This one step alone can stop a major error from happening. Okay, next step, attach. After wiping the pen's little rubber stopper with an alcohol wipe, a brand new sterile needle gets attached. And the instructor is really specific here. You have to screw it on straight. That ensures a proper connection and prevents any damage to the needle or the pen. And here's that word again from the beginning, prime. The nurse dials a tiny test dose, just 2 units, and pushes the button. They watch for a little drop of insulin to appear at the tip of the needle. This is so important. It pushes out any air bubbles, making sure the patient gets a full, accurate dose of pure medication, not air. Finally, with the pen checked, the new needle attached, and the line primed, the nurse can dial in the actual dose. In our example, they would turn that dial until the little window clearly shows the number 4 for 4 units. Now, and only now, is the pen ready. But even during the injection itself, there's one more verification. The instructor tells the student to keep that little dose window visible. Why? So they can physically watch the number count down from 4, 3, 2, 1, all the way back to 0. It's the final confirmation that the full, correct dose was actually delivered. Now, this incredibly detailed, multi-step process for just one medication, it isn't some random, isolated procedure. It's actually part of a much larger, universal framework that governs every single medication a nurse ever gives. And that whole framework is built around the number 6. 6 rules that have to be followed every single time with no exceptions. In nursing, they're known as the 6 rights. And here they are. For every patient, every time, a nurse is running this mental checklist. Am I with the right patient? Is this the right medication? Is this the right dose? Am I using the right route? Is it a pill, an injection? Is this the right time? And finally, did I create the right documentation? This 6-point check is the absolute bedrock of patient safety. And as complex as that one task was, here's the really wild part. Giving medication is just one small fraction of what a nurse actually does all day. The scope of their responsibilities is just immense. You know, as one clinical instructor put it, there's so many things, so little time. And that really says it all, doesn't it? The challenge of nursing isn't just mastering one skill. It's mastering hundreds of them and doing it all under constant time pressure. I mean, in just one shift, a nurse might do a full head-to-toe physical assessment, provide really complex wounds care, help a patient eat, safely transfer them from a bed to a chair, monitor their vitals, and be ready to respond to a code blue at a moment's notice. Every single one of those things requires its own huge body of knowledge and skill. And this kind of brings us back to our main question. When care is this complex and the stakes are this high, what does it really take? It takes science, it takes precision, and it takes this relentless attention to detail. The hidden work that we almost never see is what makes safe, effective care even possible. It's not just a job, it's a science.